When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed Sponsored Jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Welcome to the Dr. Raj podcast with Dr. Raj Dasgupta, a show all about educating patients, students, and aspiring doctors about better patient care. Dr. Raj is a quadruple board-certified physician and associate professor at the University of Southern California. He was a co-host of the TNT series Chasing the Cure with Ann Curry, as well as a regular on the TV show The Doctors. And now, here's our show.
Hi, and welcome to the Dr. Raj podcast. And what is this a podcast of? Of happiness, of wellness, of amazing people, great stories, and just doing things that help others. And that's my big theme right there. And, I met a wonderful doctor when I was kind of, doing some lectures, and I was informed about something called direct primary care. And as I'm getting more information about it, I really thought that would be interesting because the goal of direct primary care is to help patients, which is what I'm all about. So yes. We actually have a doctor here to explain this in easy terms. And this doctor is going to be Dr. Ati Hakimi. And before I introduce her, I could see that she's already pumped up to talk. I got to read her bio, and she's very impressive. So Dr. Ati Hakimi graduated from Northwestern University residency in family medicine and did an extra year of training in geriatric medicine at Rush University Medical Center. She has practiced medicine over 20 years. She moved to Las Vegas in 2016 and immediately knew she was at home. She was chosen for Leadership Las Vegas class of 2018, and that is where she found her tribe to motivate her to make a difference in the city. She was very disheartened to know that Las Vegas was number 47 in the nation in healthcare. So with the support of her lifelong leadership friends and her family, she started Vegas Direct Primary Care. She now practices medicine as she has always dreamed of. She is able to provide compassionate, quality care to all her members and treats them as if they are part of her own family. Her practice is equivalent to the Netflix of healthcare, a low and affordable flat monthly fee, which gives her members all access to a physician. Dr. Hakimi has been a past board member at Immunize Nevada, Angels of Las Vegas, and currently Candlelighters Children's Cancer Foundation of Nevada. She volunteers with Volunteers in Medicine of Southern Nevada and takes care of the elderly patients with the UNLV Nevada Interprofessional Health Aging Network. She has also been voted Top 20 Doctors of the Year by Deluxe Version Magazine and Women Who Wow by Real Nevada Magazine. She enjoys traveling the world. Apparently, she visited over 45 countries and counting. She likes karaoke, going to concerts, and enjoying amazing food from many restaurants that Vegas has to offer. And with all these being said, Ati, Dr. Hakimi, how are you today?
I'm great, Dr. Raj. How are you?
I'm doing wonderful, especially now that I get to actually, talk about something that I feel people don't know much about.
Yes.
But before we go there, I always love this question. So when did you realize that you actually wanted to be a doctor and go into the healthcare profession?
Yeah, so I think my story is that I'm also an immigrant. I came to the US at the age of 2 from Iran, and I have been working since I was 8 years old. But For me, it was, the Barbie world was a great thing, but I was the little girl that was bandaging her Barbies. So it was kind of like a calling from there. And ironically enough, my last name is Hakimi, and Hakim in Arabic is actually doctor. So somewhere down the family lines, it was determined that I would be a doctor. So my name is literally Doctor.
Well, a couple things we have in common. So my wife is Iranian, so we have that bond right there. And last night I saw the Barbie movie. So
yes,
we have in common.
exactly.
So, of all the different choices going into medicine, why family practice? And would you encourage other medical students who listen to my podcast to go into family practice?
Yeah, absolutely. So I feel family physicians are the real doctors, with all due respect, right? Because we learn everything from beginning of life to end of life care. And so when I was doing my rotations, I felt that was the best fit for me because I really enjoyed people, right? And I feel a lot of family physicians are very social individuals. So we do like to speak to our people, and we like to, discuss lives with them and things of that avail. And I really just liked everybody in terms of the age range. But I did do an extra year of geriatrics because also when I was doing my residency, I chose geriatrics as one of my options. And when I started practicing with that population, I felt like that was just good old-fashioned medicine. There was a mutual respect, and the respect was given back. And I never had grandparents when I was growing up. So everybody was my grandparents. So I really feel blessed and grateful to have been able to get this far, honestly. There was a lot of struggles in between, but family docs, like we were the gatekeepers, and we still are. The tide has changed a little bit in terms of what has happened to our, with all due respect, sick care environment that we practice in. I don't call it healthcare. I think it's sick care. As family physicians, our forte is prevention. And being able to practice that is the gift that we have. It's not really honed in as well right now. But that was the gift that we had, was to prevent things from happening to people, prevent diseases from happening. And I thought that it was an amazing opportunity to really help people, as well as children, as well as seniors, as well as adolescents. It was just such a big gamut, but I like knowing a little bit about everything. And I highly encourage future, doctors and residents to go into family medicine. I mean, you can go into so many different options with family medicine too. You can really make your career what you want it to be. It's really quite endless, right? We might be limited in terms of the residency. I mean, the fellowship options, yes, but technically, I mean, if you're really good at what you do, you can have a practice that's really focused on dermatology. You can have a practice that's focused on neurology. If you become a guru or become really focused on what you want, you can make your practice into that. So I love family medicine. I think everybody should do it. And I love seniors. They're my jam. So I did the extra year and I make a difference in that world as well.
So, before we go into direct primary care, I mean, I agree with everything you said. I always encourage, my students and residents, think about something, our population is getting older. And what is the hardest part of the ICU is not doing a procedure, is not the medicine, but the compassion of having to deal with end of life care. So I love that you did this. You mentioned preventive medicine. I know that's a very broad thing, but, do you want to mention one or two core tips, one of your go-to prevention tips that you always like to mention to your patients?
Yeah. So I've always been taught, even as a child, that our base and our foundation is the important part of our healing systems. And so what I do now is I bring that into my practice with all of my members. So I call my people my members. I call patients sick patients, but when they're in my, practice, I call them members because it's a healthcare membership, basically. So I hold them accountable for their base and their foundation. What is base and foundation? Their nutrition or lack of nutrition, their hydration or lack of hydration, their physical activity or lack of physical activity, and their sleep, right?
Yeah.
So, and then the other big one is their mood, their relationships, what's going on around them. So I truly believe that the mind and body can heal itself, because we do know there's possibilities. We've heard of things called miracles. But I believe in these things, and I believe that this vehicle that we have been given has the ability to heal itself with the right resources. And so that's what I try to bring into my practice, is making people accountable for these resources.
So, I did my due diligence. I did some research, and wow, direct primary care, it's a hot topic. People don't know much about it. So we'll start off with the basics. What is direct primary care? And you could actually lead into my follow-up question, which is, you got to compare and contrast it with concierge, and feel free to define concierge too.
Yeah, absolutely.
Yep.
So direct primary care's premise was that we wanted, as physicians, to have a direct relationship with our members once again, right? The reason why healthcare is so expensive, as you know, Dr. Raj, is there's way too many hands in the pot. And we are the only profession, honestly, that our worth is dictated by a third-party system that usually has absolutely nothing to do with what we do, and they're dictating our worth. So I think this phenomena of direct primary care, it has just spread like wildfire throughout our nation, thank goodness, because it allows physicians to take back their ability to practice quality, affordable, transparent medicine, right? And so direct primary care is like the Netflix of healthcare. It is a flat monthly fee where you have all access to your physician. And the payment plans depend on your practice. Some people will do just a flat fee based on age. Some people work with families, so they'll do a flat fee for families, and others work with businesses. So it's an option that people have in terms of healthcare. The other part of direct primary care is that, once again, we try to get all those middlemen out of the system so that we can really practice quality medicine. So insurance is important, but insurance was made for catastrophes. It wasn't made for what we're trying to do, which is prevention, right? So for me, what I've done is I've developed a relationship with the local lab in town. They give me bottom of the line prices, probably 90% less than what the insurance model does. And I save my people money that way because I pay the lab, right? So they don't have to charge.
Right.
They don't have to find people to run after people for all these copays and deductibles and pre-authorizations and nasty words that have nothing to do with medicine, right? So that's how I got rid of them. The other way is, once again, we have many, many imaging centers here, and they also would like to use their machines and be paid for it. And with all due respect, nobody wants to deal with insurance. I mean, there is no reason for me to have a certain code to get paid. We didn't learn that crap in medical school. I'm sorry. So I got rid of that option too by telling these guys, hey, listen, I've got a few people that need imaging. What's the bottom line prices? I can get an x-ray tomorrow for maybe $50 with the read, by the way. I can get a CT scan for maybe $150, $200. I can get an MRI $300, $400. That's it. We're done. Right? And then the final aspect, in the state of Nevada, as a physician, we have our own DEA numbers. So I can order medications directly from the manufacturer and dispense them to my members. Get rid of the pharmacy, right? So not everything, honestly. Unfortunately, in this country, our biggest problems right now are insulin and inhalers, long-acting inhalers. They're still extremely costly and very high price for us to even order directly from the manufacturer. But I can order blood pressure pills 3 months for $10. I can get, metformin 3 months for $5. I can get statins 3 months for $10, right? So just being able to be there for my people, I think, is what another big premise of direct primary care is access,
Yeah. And correct me if I'm wrong, when you said the Netflix, I love it because I think of the price to get a Netflix per month or per year. And
Right.
that's the benefit of a direct primary care compared to what you're going to define as concierge is price and the patient population you're looking for. You deserve the top 1% of the population, but that's not your audience right there, right? You're thinking
No.
about, hardworking people, men, women, kids, families, and we're talking a range. And I actually interviewed a couple of other people
Hmm.
who direct primary care because of you, because I was interested.
Oh, good.
We're talking monthlies of like $10 sometimes, if I'm not
Yeah.
speaking. So
Yeah.
I definitely think that the price point really separates. But you're right; it's a monthly fee, like a membership to a Hulu, to a Disney Plus, and you are taking out the middleman because you're going right there. So with that being said, how do you differentiate it? Because concierge, is
Mhm.
very similar too. There's similarities, so how do you differentiate it?
So the biggest differentiation between concierge and direct primary care
Mhm.
is concierge will charge you a large amount of monies up front, maybe $2,000 to $5,000, honestly, for access. Correct. Then they still dip into your insurance. It's a double dip. So that is one of the biggest differences between direct primary care and concierge practice. There's a lot of practices out there that are hybrids, all kinds of hybrids out there.
Yes.
There's still fee for service, DPC, maybe a dab of concierge, So my practice is completely DPC. I've actually opted out of Medicare too, because you can't legally, order things through Medicare and be billing those patients as well. So what I do is there's an option where you can opt out, but still be able to, still be able to order things, but I just don't charge Medicare for my
Oh, I see.
services.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Thursday Night Football is on, and it's only on Prime Video.
Brilliant, just brilliant.
This week, the West Coast action heats up when the Rams meet the Seahawks in a huge divisional showdown. Coverage begins at 7 p.m. Eastern with football's best party, TNF Tonight, presented by Verizon. And don't miss the Broncos and Chiefs on Christmas night. It's Thursday Night Football, only on Prime Video. Not a Prime member? Not a problem. Simply sign up for a 30-day free trial. Restrictions apply. See Amazon.com/Amazon Prime for details.
So let me ask you this question. So I was going to talk about DPC and insurance, but now that I feel better about understanding, well, once if there's a lab, there's a test that you need to order that you just don't have that deal with the company, can you order that test? I'm just making this up. Some very outrageous MRI. Can you bill insurance at that point if you need to order it for your patient? Can you explain?
Correct. So as physicians, we don't bill them, we just order it, right?
Okay.
So what we're trying to do is we still have our, physician's license and DEA numbers, so we can still act in that fee for service capacity as well. So what I tell my people, 99% of them have insurance. But we save that for catastrophes like it was meant to be. Insurance was meant to be like your car insurance, like your homeowner's insurance. It wasn't supposed to be for, maintaining things like getting a new paint job on your house or, getting your 3-month visit to the mechanic, things of that avail, right? It wasn't made for that. And that's what health insurance was supposed to be. Unfortunately, we were too busy taking care of people, and here we are. Somewhere along the lines, though, I did pick up an MBA. I have an executive healthcare MBA as well. And so I learned very early that this was a business. Right. And I was raised in businesses all my life. So I had to learn to speak the language. And the thing about it is that direct primary care is you're still able to have that quality of life without being told by a third party what your value is and is not, and what to do and not do, and what to order and not order. That business. that business model that we currently have in our healthcare system or sick care system doesn't work. So I think that was the other attractive part of that for me too, was that being able to be my own boss was very important to me. And I know it sounds very scary, and people say, well, you have an MBA. It has nothing to do with it. What I do have is a family of other direct primary care physicians that have done nothing but nurture and been there for me. And there's probably like a good 5 or 6 of us legit ones here in Las Vegas that I actually followed, and they were my mentors, and I shadowed them because I was incredulous. There's no way this is possible, and it's scary to come out making, the monies that we do to completely start over. I started over at the age of 46, y'all. It's never too late. That's the other thing. And you can start doing this as soon as you come out of residency. Find one of us. We will walk you through it. I have a young lady here right now. She's very successful. She just got out of residency, and I think she has at least, 250 members already.
Wow.
It's phenomenal all by
herself. It is phenomenal.
Yeah. But she's fierce though. She's fierce. She's all about, because she's younger. So she's doing all of this, social media. She's kind of got this down, and she's doing extremely well, but it's absolutely doable.
So let's go back to the patient. So I think let's start off. An individual has insurance, whether it's going to be a PPO or an HMO,
Yes.
and they're making the decision: how do I get my annual checkups? Should I be part of a network and have my doctor that I see? Versus what we're talking about today, doing direct primary care. So one of the questions I wanted to ask you, to make it really simple, how do you explain to those individuals that do have insurance, what are the benefits of paying this monthly and having direct primary care? Can you give me a couple of bullet points of what they get, so they'll keep it really simple?
Access.
Okay.
Access. So the biggest one for me is access, right? You literally have my phone number in your phone. You can text me, you can call me, you can email me, or you can come see me. I still do house calls. Right? Because I have a lot of seniors too that I don't want them to come out, and I don't want them to drive, because, I have a couple that's in their late 80s, and they're still completely, functional, but I just go to them and we chat and we have a good time. And I've been able to keep them healthy for quite a few years. I really do think of my people as my family. And I think that's the other relationship for us as family docs, is that's what we were called, family docs, because we were part of that family. So I've been able to develop that relationship again too. But so if you have insurance, this is kind of what I say. Yes. First of all, I ask people if they are employed or if they're self-employed. If they are employed and they have, insurance, I still want to be their primary, right? So if they have to use their insurance, I can still order things through their insurance. But I ask them, does your insurance play nice? Right? Does your insurance play nice? Because if you are getting billed for your deductible on a lab that I can do for $50, we won't do that. So I still act as a healthcare advocate through their insurance model as well. But if they play nice, yeah, absolutely. If they're going to pay for their PAP and their, annual, whatever they're supposed to be getting, absolutely. Their mammograms, things like that, absolutely. I can still order it through them.
Nice. Now, I have to have the question. So now I'm getting into this conversation. So when we talk about direct primary care, are we really focusing on the outpatient side of medicine? So everyone will be understanding. So let's say everyone unfortunately gets sick. Trust me, I know. I just came from the ICU. If that happens to anyone, unfortunately, to get admitted, now we're not talking about the benefits of direct primary care. That's a whole different avenue, correct?
Yeah, so I've been down this road several times, unfortunately, as of late too. And so my premise with my practice, remember, DPC can also be catered to what you want your ideal practice to be. Okay. So for me, if someone does end up having to go to the hospital, number one, they'll let me know first. Okay. I've had this several times. This is the situation. And so I will triage my people, and then they will go to the hospital. Okay. Now we choose what hospital to go to because I give them a call. I give them a heads up. I call the emergency room. Hey, I'm Doc so-and-so. Yeah. This is my person. I've had ER docs say, what? They said, what? I said, what do you mean, what? Why are you calling me? I was like, what do you mean? He's like, who does this? I go, I do.
That's wonderful.
Right. So that's kind of the direct primary care aspect too, because once again, these are my people. These are my people. I need to know that they're still getting good care if they leave, if they go outside. Right.
Yeah.
So I do my best to continue following them, even with the hospitalists and things of that avail. And so with direct primary care, I also have my own armament of specialists that I like to work with, that I have on my phone, literally, because I can even save people a visit to a specialist if I have these people around, and try to do that for them as well.
Sure.
Time is valuable.
Yeah, it is.
Time is valuable. We don't wait 2 hours with direct primary care. I literally go out and I get my patient or my member from the waiting room and bring them back on time. Their time is just as valuable as my time, and vice versa. We don't play those games.
So let me ask you, I got another great question. Well, I think it's a great question. So, when we talk, one of the questions I'm sure your patients, people have all the time, your members, is it going to be expensive? You know what I mean? Because of course, even though we're not talking about concierge per se, it's still a Netflix membership like we're joking about. So my question is, if it's going to be someone who's, let's call Dr. Raj's age, on the younger side. So if it's someone like me who just wants follow-up once in a while, you know what I mean? Is that your members get the most benefit from that? Contrary, I'm thinking about my mom and dad. They're still alive, but I got to tell you, Ati, my dad's got a boatload of problems and probably needs a lot of visits, a lot of care. You know what I mean?
Yeah.
Is that still going to be optimal? Is it going to be more expensive at that point? Can you help me with that concept?
Yeah, so I think that is the concept that we miss completely in terms of our country of prevention. I don't want you to come to me when you're sick. I don't want you to wait for that, right? So I usually try to meet with my people once a month.
Wow.
We meet once a month, and because of the advent of COVID, the only good thing about that, honestly, was that telemedicine became a norm and acceptable. So people feel more comfortable, right?
Sure.
So I will jump online once a month and we will chat. Hey, how's it going? Right? How's it going? Are you sleeping? What are you eating? How much water are you drinking? Right? Because that goes back to what we do best as family medicine. And so people will call it holistic. People will call it functional. People will call it integrative. Lovely. Call it what you want to call it. I'm okay with that. But that's medicine too. And that's what we were taught from day one of medical school, right?
Yeah, yeah.
So that's really what I just try to do, is hold people accountable. So the value is, yes, I will see you once a month.
So I'm going to throw a curveball question at you. I just kind of made this up while we're talking. So, we're talking about, direct primary care versus concierge. And I'm sure you have friends that do both. Are you folks competing with each other? Or are there two, you know what I mean? Like, you know what I mean? When no one's looking, are you punching someone in concierge in the gut, or and vice versa? So how is it?
So I think for us in Las Vegas, we have about 2.2 million people here now. And I don't feel like there is that battle going on, because there's just so many needs out there to be met by anyone, right?
Yep.
So I don't feel that. But like I said, I do feel that there are a lot of hybrid practices out there too. And the definition of what you think is quality care depends on you too, because for me, my sweet spot is 200 and I'm done.
Okay.
Right? Because I was used to taking, and people are like, wow, 200. I'm like, you understand we're dictated to take care of 1,000 to 1,500, and that's why you get 10 minutes.
Time is the,
correct?
And you're right. That
Yeah,
the amount of time that you get to spend, I know. It's
200. So I will spend, my first visit is about an hour plus.
That's wonderful.
Right? And that's to get to know you.
Yeah.
And then from there on, there's always 30 minutes to 60 minutes at a time. And my people know that, when we're going to sit together, we're going to sit together. And oh, by the way, I'm a one-woman show. I don't have any staff. I don't need staff, because with all due respect, I can schedule my own people. The advent of these things,
yep.
that's the other invaluable, right? That's what we had those things for, is to be able to do these kinds of things. I can do my own vitals. I'm good. Right?
I believe you.
And I don't have a biller or a coder or any of these words.
Okay.
And so that's staff. And I don't have to have all those things, because I don't do that.
And for the listeners, it's because you don't have that overhead that you could have a lower monthly rate fee.
Absolutely.
Now,
absolutely. And that's huge.
No, definitely.
People have to understand that's huge. And then the accountability is on me too. So literally when I pick up the phone, people will be like, are you the doctor? Yes. Why are you picking up the phone? I've had people hang up on me, call back, hang up.
Because they don't believe it.
No, because they thought it's an answering machine.
That's funny.
You know, it's funny, but it's sad. I mean, when you call to see if you know the office is taking new patients, your first question should not be, what insurance do you take?
Well said. Yeah.
That is not the first question. It should be, how long have you been practicing? What is your specialty? What type of medicine do you? These are the questions it should be. And so, like I said, when people cold call me, because I've got at least 50 reviews on Google that I'm very proud of, and that's a lot of the ways people find us, you know, the Google reviews. And when I explain to them why I have those reviews, I mean, I understand it's not for everybody, but I will still explain to you why those reviews happen, because unfortunately, the current sick care model does not allow me to practice the ideal medicine that I've been taught. 14 years does not translate to 10 minutes.
No. And I know a few things for people listening. You know, I met you in person, and I got to tell you, your passion for this topic. And, you know, you heard I had a podcast, and you were so nice to come up to me. And your first thing was, do I know what this is? And you told me how you wanted to spread the word just to help people. And that's why you're here.
Yes.
I want to ask you a question before we get some information about you and give some more information to my patients. You know, if someone's interested in this, and I'm going to use it in terms of, hey, maybe it's concierge, maybe it's direct primary care, maybe it's a different model than traditional, hey, I want to be a hospitalist or I want to join a group practice. Can you expand on what should they start doing during their residency to kind of help them with this? Is it all luck? Is it all just the mentor? But what can they do?
We actually have various forums now. DPC Alliance is one of them. And then we also have various conferences that they can go to start a DPC practice.
Wow.
Of course, there's social media. So if you look up DPC docs, we're out there as well. We have a mapper, is what it's called, a DPC mapper, where people can go and find a local direct primary care in their area by just putting in a zip code.
Nice.
This is a fully functional world that we have developed for anyone that's interested. But I do recommend that people find someone locally, because a lot of us DPC docs, we like to bring in our medical students, we like to bring in our residents so that they can shadow us, so that they can realize this is completely doable. If you don't want to be employed, I highly recommend it. I don't have any regrets in my life, Dr. Raj, but this I should have started a little bit sooner.
Oh, but I want to say that you were talking about the you know, getting yourself out there, and this leads to my last question, which, wow, this conversation went pretty quick, which is, if they want to learn more about you particular and your practice, do you have something on social media? Do you have a website that people could learn more about you that you want to mention?
Yeah, absolutely. So my website is www.vegasdpc, which is davidpaulcharlie.com. I am also on Instagram, Vegas Direct Primary Care. I also am on LinkedIn, as well as Instagram. But bear with me, it's all Vegas Direct Primary Care, but I am a little bit older, so I do the best I can with that as well. If anybody wants to volunteer to help me, you're welcome to do that. That would be amazing. And my number, anybody can have, it's 702-829-0478. It's online, it's everywhere. And I'm more than happy if it's a resident, a med student, person that's interested in joining a direct primary care, to help guide them as to how this works, because it's still a little foreign.
It is.
It's either too good to be true, or what's the catch? You know, this kind of thing. And there's no catches. It's about, like I said, quality, transparent, affordable healthcare with physicians that really do care. We are out there It's the system. It's not us. I have to say that over and over to everyone. It's the system. It's not us. There's actually specialists going into DPC as well. They're calling themselves direct specialty care.
Oh, interesting.
So we are trying to, because there's a lot of chronic diseases out there. So a lot of people they're specialists they can see more frequently with that routine quality care as well. DPC is not expensive, you guys. Like you said, it's probably, like $10 probably for the kids, and it can go up to maybe $100, $150. But listen, I live in Las Vegas. 2 drinks will cost you $100 here. So, it's all relative. You're in California, right?
Yes.
Right. It's relative. And I think a lot of us have based the prices based on our location, of course, and need. And I have everybody from the Uber drivers to the CEOs to the to the immigrant population that doesn't speak the language very well. I speak Spanish as well. So I've actually been able to help that. And people need to know that they have an option in healthcare. Direct primary care is absolutely an option. In an ideal world, direct primary care, HSA, health savings account, and a catastrophic plan or a health share plan is the perfect healthcare.
Man, well, I'm going to say this. I mean, you get me so enthralled. I'm just staring at you during your conversation. But no, honestly, Dr. Hakimi, thank you for being here today. And,
Thank you.
I really do feel that, medical students and residents need more options out there. Healthcare is definitely changing in landscape in many different ways. And you just scream passion, and the way you are in person is the way you are during this conversation. And I will definitely say that, I'm sure your members are very fortunate to have you.
Thank you.
Thank you for being here today.
I feel blessed to be there for them as well. It's likewise.
Thanks,
Dr. Raj. Thanks for everything you do too. We appreciate you. See you in Vegas soon.
Okay. And everyone listening today, thank you. And I hope you enjoyed this episode of the Dr. Raj podcast. And I'll be seeing everyone again in a couple of weeks.
Woohoo!
Thanks for listening. This has been a production of Ars Longa Media. Our producers are Madison Linden and Chris Brightigan. Our executive producer is Dr. Patrick Beeman. This podcast is for educational purposes only and not intended for medical advice. Ars Longa, Vita Brevis.